I'll talk about the preclinical research work that has been done for histotripsy. There are a number of research that have shown that histotripsy can be used for numerous applications, including and not limited to the list here: cancer, blood clots-related disease, brain diseases, fetal intervention, kidney stones, tendon injury, biofilm, and bacteria. So I want to highlight three preclinical research today, including cancer, blood clot-related disease, and brain diseases. Start with the histotripsy cancer research. And for cancer research, histotripsy has also been investigated for a number of different cancer treatments, including, and again not limited to, liver cancer, renal cancer, prostate cancer, breast cancer, pancreatic cancer, actually brain cancer too, musculoskeletal tumors, sarcoma, and also histotripsy has been shown to stimulate immune response. So first we'll start with liver cancer. And this shows a study done by Tejaswi Walekar in my group, and she studied the liver cancer in this orthotopic, immunocompetent rat liver tumor model. So as you can see in the MRI images here, on the MRI images, there's actually tumor shown in the rat liver. So on the top row showing this complete treatment group where the tumor with a margin, the entirety of the tumor has been targeted by histotripsy using the parameters on the slides. And then within 1 to 2 months after treatment, the acellular debris treated by histotripsy entirely absorbed by the body, and the tumor is gone and you cannot see on MRI images. And at the study endpoint, 12 weeks, you can see the histology here. No tumor cells can be detected, and there's only a sub-millimeter scarring tissue left. And the bottom row here shows another cohort of animals. And in this animal, only 75% of tumor was treated, pointed by the yellow arrow here. And the blue arrow pointed to the 25% untreated tumor. And interestingly, in 5 of the 6 rats in this partial treatment group, also within 1 to 2 months of time post-treatment, the tumor is completely regressed and not detectable on MRI. And they survived to the 12-week study endpoint, also showing no tumor cells with only scarring tissue. So this is another study in also an orthotopic immunocompetent rat liver tumor model, but it's more aggressive. So in the control group of 11 rats as shown here, the MRI image is showing that within 2 to 3 weeks, so the tumor grew really large, then there's metastasis all over the liver, and all these 11 rats had to be sacrificed. In the treated group, out of the 11 rats, so all the rats actually received histotripsy treatment, but only 50% to 70% of tumor was treated. And 9 of the 11 rats from the treatment group actually had a complete tumor regression. And they all lived to 3 months study endpoint and tumor-free with no metastasis observed. So this is actually very interesting. And boiling histotripsy have also been shown to be able to effectively ablate liver and kidney. And this is showing the work from University of Washington group. And as you can see here from the ultrasound imaging showing the bubbles generated in the kidney by boiling histotripsy, and then post-treatment showing the hypoacusome and corresponding morphology showing the liquefied lesion in the kidney, and this is in the pig. So previous slides, I talk about some of the work we have done showing that partial histotripsy ablation in the liver tumor model actually leads to complete tumor regression. So what's the mechanism? Why? And histotripsy has been demonstrated to actually stimulate immune response. So histotripsy mechanically disrupts the tumor cell membrane without using ionization or heating. And this allows the tumor antigen to be preserved. So releasing the functional tumor antigen is the first step of immunostimulation. Histotripsy also induces immunological cell death and the cascade of inflammatory and immune response effects later. So a study done by Cliff Cho's group in collaboration with our group showing that histotripsy actually stimulates more CD8 plus T cell compared to radiation therapy or radiofrequency thermal ablation. So Dr. Cliff Cho uses this two-tumor mouse model and treated only one tumor with histotripsy, and the contralateral side was not treated. In both sides, histotripsy treatment of only one tumor actually stimulated significantly more CD8 plus T cells, both on the treated side and the contralateral untreated side. And that immune response was so significant such that when he actually treated just a primary melanoma in the mouse, and it actually reduces the lung metastasis significantly compared to the control untreated mice. So he also studied using that true tumor model to study the temporal evolution of histotripsy immunostimulation. And in the treated side, as you can see, the data showed that the histotripsy actually significantly changed the the T cells. There is actually natural killer cells, inflammatory cells, neutrophils. All those actually showed significant change. And interesting enough that the abscopal untreated contralateral side, the immune response seemed to be similar to the treated side, but however, is about 7 days later. So I only want to mention that this immunostimulation effects has also been observed by other groups, including the Virginia Tech group by Dr. Coy Allen and Eli Vesovich, as well as the University of Washington group. For bone histotripsy too, there's also immune stimulation effects. So the second preclinical research that I want to talk about is blood clot related applications. So blood clot formation can actually lead to different disease. So University of Washington group has studied this large hematoma, which is a blood clot formed from the sport injury. So they have shown that histotripsy can actually be used to liquefy the clot, and that liquefied clot can be aspirated out, use a needle. So this actually can allow the quick evacuation with a large hematoma. So our group have been studying histotripsy for treatment of deep vein thrombosis. As shown in the video here, this is an in vivo porcine deep vein thrombosis model where a blood clot actually formed within the femoral vein of the pig leg. And a cavitation clot is generated, which is this bright structure here, and it's confined within the vein and actually scanned over the clot. And as you can see, as it scans over, it cleans up the clots and open up the clean up the vessel. And right after treatment, ultrasound B mode and Doppler videos were taken. So right before the treatment, the femoral vein was completely blocked. And right after treatment, Doppler shows that the flow was restored. And 2 weeks later, still open. So the last preclinical research topic I want to talk about is brain diseases. So treating through the skull for non-invasive treatment of brain disease is very challenging for histotripsy because histotripsy requires such a high pressure. So this picture here showing the 360 element 700 kilohertz transcranial histotripsy array that has been developed by our lab. And this transducer is currently the most powerful ultrasound transducer in the world. And it can generate well past 30 megapascal through the skull, and it also has good electronic steering range. In addition, the driving electronics allow both transmission and receive. So this transducer can be used to generate histotripsy through the skull, as well as receive ultrasound signals for imaging purposes. So because of the speed of sound in the bone is much higher than soft tissue, and the skull is not uniform in thickness, so when you have ultrasound propagating through the skull, there's going to be a defocusing effect, and also the ultrasound pressure is going to be significantly reduced. And that is a phenomenon termed the aberration effect. So in order to treat through the skull, we have to correct for the aberration effect. And there are different ways of doing it. We have developed this two-step aberration approach, where the first step is to use simulation based on the CT scan of the brain of the skull. Then the second step actually calculates the travel time between individual array element to the cavitation site based on the acoustic emission signal. So those will be used to actually calculate the phase and time that need to be used to adjust the transmission signal to allow the correction of the aberration effect and allow refocusing through the skull and the recovery of the pressure loss through the skull, and enable the transcranial treatment. And this has been allowing us to do actually transcranial treatment through excised human skull. So here shows the example where, guided by MRI in real time, using an MRI-compatible transcranial histotripsy array, the same array as I showed you earlier, the 360 element array, this actually have been used to treat through excised human skull, shown on the MRI image here, into the live pig brain to create clear lesions here. In another study that we have done more recently, that transcranial histotripsy was used to actually treat into the human cadaver brain through the skull. So it's worth noting that because histotripsy actually uses bubbles to mechanically fractionate tissue, therefore we can use really long wait time between pulses or a low duty cycle to minimize the skull heating. So by mitigating the heating of the skull, this allows histotripsy to potentially treat a wide range of locations within the brain compared to a limited treatment location profile that is by the thermal HIFU treatment, transcranial treatment.